Hello guys and welcome back to my channel. My name is Tommy. I'm a human nutrition student and researcher at the university. What I do in this type of videos you already know. I synthesize the lessons of the university and then I explain to you the best and most valuable information you need to know. This series is the clinical nutrition series of videos. And today we're going to continue by taking a look at the nutrition in the different stages of life. So let's begin. Nutrition in the elderly. I already talked about this in other series, if you remember from last year, but this is a different focus because it is the nutrition for the elderly in the clinic. So, these patients have a lot of malnutrition because old people tend to lose muscle mass, increase body fat, decrease the bone, and also the water. They also lose the senses of sight, hearing, olfactory, and taste sensitiveness. There are also other problems such as slowing down of digestive processes, loss of teeth, dysphagia, and xerostomia. So what do we do in this situation? We have to do a nutritional status assessment as always. Using the screening, it is the simplified MNA. I've talked about this in previous videos. This is the screening meant to be done with the elderly specifically. Then there are also the GLIM and the MUST screenings. And after doing those, we gather the information over the malnutrition, and if the intake is lower than 75%, we give them supplements. If the intake is lower than 50%, we have to give them enteral nutrition. There's also another screening for this type of people, which is the SARC-F, and it evaluates sarcopenia, a disease common in this range of age. On the other hand, we have the nutritional assessment. And here we have to do an analytical test and check the albumin, the cholesterol, and the lymphocytes. Albumin lower than 3 grams, not good. Cholesterol lower than 180, not good as well, because cholesterol is essential for the membranes and also the steroidal hormones. And lymphocytes for the defense. The body mass index over 65 years old should be around 25 to 30. This is increased because the normal is between 18.5 and 24.9. Here we get the range a little bit higher because of sarcopenia. There is a higher risk of sarcopenia, therefore we have to increase it. We also take a look at calves circumference, and if it is lower than 35 in men and lower than 33 in women, then we have to check for sarcopenia. And also we take a look at the strength levels using a dynamometry. This will tell us about the appendicular skeletal mass, and if it is lower than 20 kilograms in men and lower than 15 in women, then we have to check for sarcopenia as well. These are parameters that are very important to take a look. The malnutrition and the sarcopenia, they tend to be together. And then the nutritional treatment, 30 kilocalories per kilogram of body weight a day, spread over several meals. And the artificial nutrition only if needed. In terms of protein, we have to give over 1 gram of protein per kilogram per day of high quality proteins, so animal proteins. Two types, the whey protein, which is a high quality protein from the milk, and the casein as well, because the casein is a high absorption protein. So we get the benefit of the two, higher quality and high absorption. Protein is needed to trigger the mTOR, which is an anabolic way, which leads to muscle construction. Indeed, all of this is done to avoid sarcopenia. Moving on, we have the nutrition in children. Children needs are increased, and they also have immaturity. Therefore, this is a state of vulnerability. The goal here is the growth and development without diseases, because it is very easy to find malnutrition in children, because they have higher needs, immaturity of the organs, and a poor diet in the majority of the cases. We have to distinguish the diet by location, culture, age, sex and genetics, without deficits and also without excess. The amount of water needed in children is calculated using the age, the calories and the losses, because the age range is so different and also the calories burned are so different, and the losses as well. They depend on many factors. The carbohydrates, they have to be complex and less than 10% refined if possible. Fiber, 5 grams a day plus the age. So for example, a 10-year-old child should have 15 grams of fiber a day. Fat, saturated less than 10%, monounsaturated from 10 to 20, and polyunsaturated from 7 to 10%. And also keep the trans fat very low. Protein from 10 to 15%. General recommendations. We follow the pyramid here. Bread, milk, whole grains, fruits, and veggies on a daily basis. Avoid juices, processed food, sweets, limit the red and processed meat, and prioritize legumes, fish, olive oil, and nuts. We also have to promote breastfeeding in the infants. And cow's milk has a high kidney solute load. That's why breast milk is always better. Indeed, if you know, there are formulas that change the cow milk so much to make it more similar to breast milk indeed, which is superior. So promote breastfeeding. The use of artificial nutrition only when there is malnutrition. In case of marasm, which is a caloric malnutrition, or the kwashiorkor, the proteic malnutrition. The treatment is a proper refeeding. Proper to avoid the refeeding syndrome. Remember that. Nutrition in pregnancy, breastfeeding, and menopause. So I have done a video in the health nutrition series of videos, to be precise, in the stages of life video, in which I talk about the pregnancy, the breastfeeding, but also the children and elderly nutrition in much more detail. But since I didn't talk about the menopause, I will explain it a little bit here. So the menopause is the loss of menstruation and lower estrogen levels. This is correlated with elevated risk of osteoporosis with hip fracture. The diet must be a little bit lower in calories. Carbs must be between 55 and 60%, proteins between 10 and 15%, and fats between 20 and 35. Here what we have to do in these cases, when the estrogen levels are low, we have a risk of osteoporosis. Increase the protein quality, so the milk, the meat, the cheese, the eggs, especially the eggs, and most important, a proper amount of calcium, around 1 gram a day, and vitamin D. Vitamin D from the sun, but also from the food. All of this is related to the bones. And now we talk about the eating disorders. So these are the anorexia nervosa, the bulimia nervosa, and the binge eating disorder. The diagnosis is using the ICD-10 and the DSM-5, which I explain in much more detail in this video right here. What do we do with these patients? The nutritional assessment, to check if there is malnutrition, using the anamnesis, the clinical history, and then the diet evaluation. Now let's take a look at the complications. So medical type of complications can be endocrine metabolic, having to do with GH or IGF-1, these are growth hormones, adrenal, thyroid, insulin, gonadal, lower hormones, and also neurohypophysis. So basically these disorders can create endocrine metabolic disturbances. They can create problems in the growth and in development of the body. As you can see, all the hormones are deregulated and they do not work properly. Also bones, osteopenia and osteoporosis can appear at the gastrointestinal level, hepatocyte autophagy, and or constipation. In a cardiovascular level, cardiac atrophy, bradycardia or hypotension. Hematological, we can have an anemia because of lower absorption or lower intake of vitamin B9 and B12, as well as iron, but also leukopenia. Neurological, such as cerebral atrophy, we have no nutrients to give them to the brain, or neuropathies. Pulmonary, such as respiratory muscle weakness, no nutrients for the muscles again, and also pneumothorax. Dermatological, dryness of the skin, acne, bruises, and stretch marks. Again, we don't have the proper nutrients to make our body work correctly. From purgative behaviors, well, of course, the self-induction of vomiting, dental complications, salivary gland involvement, oral bleeding, esophagus and stomach disturbances, cardiac complications, and also abuse of laxatives and diuretics can have an impact in the renal, gastrointestinal, cardiac, and musculoskeletal functions. So as you can see, purgative behaviors, which are present in the anorexia nervosa and in the bulimia nervosa, they affect mainly the gastrointestinal tube, but also the heart, the kidneys, and the muscles. Psychiatric complications, we have affective disorders, depression, social withdrawal, low self-esteem, anxiety disorders, agoraphobia, panic, social phobia, substance abuse, and can affect up to 10%. There are problems with distortion of the body image perception, with the standard of a healthy body, and with society indeed, because we are not comfortable eating out with others, for example. Here we have to differentiate between inpatient hospital and outpatient ambulatory management. In the hospital, what do? Is a nutritional rehabilitation. We set a weight goal. We have to give them the most appropriate feeding route, choose the one that is better for them. Avoidance of refeeding syndrome, very, very important, especially in the anorexia nervosa, and then monitoring, of course. In the ambulatory, on the other hand, we have to get a nutrition education program, an initial assessment, and monitoring. Okay, thank you so much for watching. This is it for this video. I hope you understood everything I said. If you didn't, there is a comment section down below. Remember to like, subscribe, and turn on the notifications so you get notified every time I upload a new video. Thank you so much for watching again, and I will see you in the next one. Ciao!